Welcome to the last section in Unit 3, Heat Therapy or Heat Treatment. In this lecture, we're going to discuss the effects of heat treatments, methods, contraindications, and potential adverse reactions. This can be a very useful treatment. Often clients don't like the feeling of ice, and it can be appropriate to use heat instead of ice quite often, but definitely not during the acute stages of an injury. It can be great for muscles that are tight or spasmed but not injured. I will often advise heat after a treatment if it's been a particularly deep treatment or the client has found it uncomfortable or is quite stiff. It can be really useful in these circumstances. Heat is soothing, so can often mentally aid the client as well. The effects of heat are to stimulate vasodilation, so this is opening up the blood vessels and increasing the circulation in the area. This will increase blood flow, and that will in turn increase the delivery of oxygen and nutrients to the area while improving the removal of waste products. It will increase local and general relaxation. Heat is very soothing for most people, so it will aid in general relaxation of both the mind and the body. The warmth will soothe the local area as well. Again, because of the pain gate theory as mentioned in cryotherapy, heat will help to reduce pain. And finally, it can be used as a passive warming method. So this can be either in-clinic pre-treatment, or if a client is struggling with rehab, a sort of limited range of movement maybe, it could be used here to warm the tissues before they start trying to do their rehab. There are three forms of providing heat treatment. So the first is conduction, and is the most common. This one the client can use at home very easily. So this is the transference of heat from a warmer object to a cooler object. In this case, it would probably be something like a wheat pack, hot water bottle, or pack that you can use as a hot or cold pack. Next is convection. This is the process of heat transference to a solid object from a gas or a liquid. This is usually something like hydrotherapy or water submersion. So a client could simulate something like this at home with a bath, and this would give them a whole body relaxation as well, which will be really beneficial for them. Finally, we have conversion. This involves converting one form of energy into another. So in this case, we're thinking about something like ultrasound, and this is normally carried out in a clinic. As a sports massage therapist, you can do CPD courses, which will allow you to offer this as a service. There are heating creams and massage lotions, but personally I've never tried them, so I'm not really sure about them. But I would imagine they only penetrate to a very superficial level. So they might be nice as a soothing thing, but I'm not sure that they'll have much relief pain-wise. We would normally be looking at heat packs of some description or a bath for home use. Packs can be used in the clinic. Ultrasound, as already mentioned, requires training, but this is a very good option and can treat various issues as well. So you're looking for a temperature roughly between 40 to 45 Celsius. And the length of treatment will depend on the depth of the area, just like the ice therapy. So if it's very superficial, it won't be very long. If it's very deep, it will be much longer. So somewhere between 5 to 30 minutes. Take care to protect the client's skin from heat, so not too hot, and potentially there needs to be something between the heat and the skin. This is where wheat bags are quite handy, but they can't be used in the clinic because they're covered in a material, so not so hygienic, but very comfortable for a client at home. Hot and cold packs would require something wrapped around them because they're plastic, so they're not very comfortable. Again, it is really a very, very simple treatment and inexpensive and relatively safe for your client. So as with all treatments, there are contraindications to consider, and heat is no different. Heat should not be used in the acute stage of an injury. You will increase the circulation and promote vasodilation, which will increase the swelling and cause more problems. The next one to consider is anyone with diagnosed low blood pressure. Because of the vasodilation, you will cause the blood pressure to drop further, so that's not very safe for your client. If there is any signs of inflammation at all, again, no use of heat. Issues with skin sensation or with nerve ending damage is also out, purely because they can't sense the temperature of the pack, and it's exactly the same as ice. You can't feel what's going on, so therefore you're likely to cause damage. Anyone with thin or damaged skin, circulatory issues, again, diabetes with neuropathy, damaged or limited sensation in the skin, open wounds, or damaged skin. A deep vein thrombosis is one that you should not use heat with. DVTs, you do not want to encourage them to move around the body, and they're really a medical emergency, so they should be seeing the A&E or GP at least. Also, some skin conditions, you may irritate the condition, or it may be oversensitive and more painful. And certain medications as well can increase the risk of hemorrhaging. So there's a few things there to consider. So that's reasons not to treat. Let's look at potential adverse reactions to treating. And again, these are very rare. So it's very similar to your cold therapy. It's not something that's going to be happening very often, and most likely if it does, it's because there's an unknown underlying medical condition. Again, don't let this put you off recommending treatment to your clients, because it can be very useful. So the first one is obviously burns, and that's generally because the pack is too hot or it's left on too long or the skin's not protected. Hypertension, so that's lowering of the blood pressure caused by the vasodilation of the blood vessels. Discomfort or pain, again, because it's too hot, been left on too long, or there's an underlying condition. And then dizziness, potentially from hypertension, and nausea. If your client experiences any of these issues, treatment should be discontinued immediately, and as with ice, medical advice sought for them. You have now completed section 3 of unit 3 and can complete the associated quiz with the unit. You can carry on and also complete the worksheet as you've completed all the relevant information for this section.